Hey everyone, my name is Dr. Bassi. I'm an addiction psychiatrist, and I wanted to talk about a study that could be of relevance to somebody who's struggling stopping alcohol. And this study was published 2 days ago on September 20th, 2022 in the Journal of Molecular Psychiatry, and it was looking at spironolactone. For those who don't know, spironolactone is known as aldactone. It's a diuretic and is used to treat high blood pressure via excretion of fluid. So an individual who has edema or fluid retention for some reason, they would be started on spironolactone to diurese them and to have the fluid be released by urination. And it could also be used to treat acne, and it has some side effects, and we'll talk about those in a second. The study was published a couple of days ago, Journal of Molecular Psychiatry, and it had two parts to it. The first part was looking at the behavior of rats when they were taking spironolactone, and found that they're less likely to drink alcohol. Believe it or not, they were studying their behavior in a laboratory setting. And then the other part of the study was looking at the VA records, Veteran Administration records, and found that individuals who were taking more than 50 milligrams of spironolactone per day had a reduction of alcohol consumption. I think this study is relevant and important because we only have 3 medications that we use FDA approved to treat alcoholism, although we do sometimes use some off-label medications like gabapentin, baclofen, to potentially topiramate to reduce alcohol use, but really only 3 FDA approved ones. So having another tool in your arsenal can be very helpful, especially in a certain patient population. So I would consider spironolactone in somebody who's older, female, potentially has liver disease, high blood pressure, liver cirrhosis. And in that population, I would consider it, because in a younger population, males, I think spironolactone has feminization properties where it causes breast tenderness, breast enlargement, lower libido, erectile dysfunction. And obviously young men would not want that issue, even older men, but more likely younger men, because they'll be more likely to notice those side effects. So helpful study, keep it on your mind. We don't use it very often in psychiatry, but we do sometimes steal all their medications that have a primary medical purpose, and maybe we can consider a standard of care in psychiatry to start using more spironolactone for the treatment of alcoholism.